12 signs of magnesium deficiency your body is warning you about. Did you know that magnesium plays an important role in more than 300 different biochemical processes that take place in your body? These can include anything from the regulation of blood pressure and nerve function to the production of energy for your body. Even though magnesium does not get as much attention as calcium or iron, its importance to your body is just as great. Magnesium deficiency, also known as hypomagnesemia, is a condition that is frequently disregarded as a potential health risk. The symptoms of magnesium deficiency can vary from person to person. They could be either mental or physical in nature. Magnesium deficiency affects between 3 and 15% of Americans. However, the prevalence of this condition is much higher among patients in intensive care units and hospitals, as well as among people who have diabetes or alcohol use disorders. In order to prevent serious health problems like diabetes, chronic diarrhea, and celiac disease, it is crucial to recognize the signs of magnesium deficiency as soon as possible. In today's video, we will discuss the warning signs that indicate your body is lacking magnesium. Always consult your primary care physician or a dietitian before making any changes to your diet, especially if you are experiencing any symptoms that could indicate a magnesium deficiency. Let's get started. 1. Muscle cramps. Magnesium is an essential component in the process that helps your muscles relax and controls the frequency and intensity of muscle contractions. If you suffer from leg cramps on a regular basis, one possible explanation is that your body requires a greater quantity of magnesium. According to a 2017 study, up to 2/3 of the population in the United States is magnesium deficient. For older adults who are experiencing muscle cramping, relieving the discomfort is more difficult than taking a magnesium supplement. Studies have shown that magnesium can help relieve cramps and twitches in a variety of different types of people who are deficient in it. If increasing the amount of magnesium you consume does not help stop your cramps, there are other treatments you can experiment with. According to studies, the most beneficial method may be stretching. Hypocalcemia, also known as a lack of calcium, is another condition that can result from magnesium deficiency. Like magnesium deficiency, this condition causes muscle spasms and cramps. Keep in mind that a variety of other conditions can also cause involuntary muscle twitches. A number of factors, such as anxiety or excessive caffeine consumption, can cause involuntary muscle spasms. 2. Abnormal heart rhythm. Your body requires magnesium, which is both a mineral and an electrolyte, in order to keep normal nerve and electrical impulses in the heart functioning. One of the potentially serious side effects of magnesium deficiency is heart arrhythmia, also known as an irregular heartbeat. There is a wide range of possible symptoms associated with arrhythmia, from none at all to those that are life-threatening. Some people may experience heart palpitations or irregular heartbeats as a result of it. In the most extreme cases, arrhythmias can raise the risk of having a stroke or developing heart failure. In addition, research has shown that not getting enough magnesium in one's diet and having low serum levels both have a negative impact on the health of multiple aspects of the heart. Research has shown that increasing the amount of magnesium in one's diet by an additional 100 milligrams per day is associated with improved cardiovascular health. 3. Having difficulty sleeping. Magnesium is the mineral that most effectively promotes relaxation. Both the mind and the body can benefit from magnesium's ability to relax them, making for a more restful night's sleep. In addition, GABA receptors in your brain cannot do their job properly without magnesium. GABA, otherwise known as gamma-aminobutyric acid, is a neurotransmitter that helps your brain enter a calmer state, which in turn helps you get a better night's sleep. Some researchers believe that magnesium deficiency may contribute to poor sleep quality by interfering with nerve signaling and influencing the levels of hormones that are involved in the production of sleep, such as melatonin. Not only does magnesium have the potential to assist you in falling asleep, but it also plays a role in assisting you in achieving a more restful and profound level of sleep. Researchers in one study gave elderly people either 500 milligrams of magnesium or a placebo. In general, those in the magnesium group experienced a higher quality of sleep. This group also demonstrated increased levels of the hormones renin and melatonin, both of which play a role in the regulation of sleep. 4. Osteoporosis. People who don't get enough magnesium have a greater chance of developing this condition, which causes your bones to become more fragile and increases your likelihood of breaking them. However, getting the recommended daily allowance of magnesium can be beneficial in more ways than one. Studies have found that the bones of women who have osteoporosis have a lower magnesium content and larger hydroxyapatite crystals than the bones of women who do not have the disease. A sufficient intake of magnesium is linked to increased bone mineral density and has the additional benefit of being able to prevent hypocalcemia. Even though magnesium, or a lack of magnesium, can act directly on your bones, it also affects their strength by causing a lack of calcium, which in turn affects how strong your bones are. 5. Mental disorders. One of the potential side effects of magnesium deficiency is mental illness. Apathy is one of these conditions. It is characterized by a lack of mental stimulation or emotional involvement, and it is one of the most common mental illnesses. If the deficiency continues to get worse, it could even cause delirium and coma. In addition, observational studies have shown a correlation between low magnesium levels and an increased likelihood of developing depression. Some researchers have connected a deficiency in magnesium to an elevated risk of anxiety. According to the findings of one study, taking magnesium supplements could be beneficial for some individuals who suffer from anxiety disorders. Some people are more susceptible to developing mental health issues and nerve dysfunction due to a magnesium deficiency than others. 6. Fatigue. A magnesium deficiency can cause a variety of symptoms, but fatigue and exhaustion are two of the most common. A magnesium deficiency can manifest itself in a variety of ways, including general fatigue as well as specific muscle weakness. Low magnesium levels can disrupt a number of different processes in the body, including nerve signaling and potassium levels in muscle cells, both of which can lead to fatigue and a general feeling of weakness. According to studies done on people who suffer from chronic fatigue syndrome, magnesium can help provide support in the fight against fatigue. This is due to the fact that magnesium is an essential component in the body's process of converting food into usable energy. If your body does not have sufficient access to magnesium, its ability to produce energy will suffer, leaving you more susceptible to fatigue. 7. Asthma. Asthma sufferers are more likely to be magnesium deficient than people who do not suffer from asthma and are otherwise healthy. The vast majority of studies have linked low magnesium levels to a buildup of calcium that has been poorly absorbed in the muscles lining the airway leading to the lungs. As a direct consequence of this, those passages become constricted, making it difficult to maintain normal breathing. Because of this, patients who have been diagnosed with severe asthma are frequently given magnesium sulfate inhalers and emergency injections to combat life-threatening symptoms. Magnesium sulfate inhalers are used to instantly expand and relax the airways. However, there is a lack of consistency in the evidence supporting the efficacy of dietary magnesium supplements for people who suffer from asthma. 8. Elevated blood pressure. Magnesium and calcium work together to support healthy blood pressure and heart health. Magnesium is also important for bone health. A lack of magnesium and calcium can be a contributing factor in high blood pressure, also known as hypertension, and because hypertension is the root cause of half of all ischemic strokes, the best course of action is to practice preventative medicine and consume an adequate amount of magnesium. According to one piece of research, eating foods that are high in magnesium may cut the risk of having a stroke by as much as 8%. In another study, the efficacy of magnesium supplements was tested in patients suffering from heart disease. The researchers discovered that patients with heart disease who took magnesium supplements for a period of 6 months, twice daily, had improved physical stamina and healthier blood vessels. 9. Tingly sensations. As one of its functions, magnesium is responsible for ensuring that your nerves and muscles are always firing in the correct manner. If you notice that the opposite happens to you on a regular basis, this could be an indication that you aren't taking in enough on a regular basis. If your legs frequently feel like they have fallen asleep, or if your fingers and toes are constantly numb or tingling, this could be a sign that your body is lacking the magnesium it needs to properly conduct the functions of your nervous system. 10. Increased blood sugar levels. It may come as a surprise, but the amount of magnesium in your body can have an effect on your blood sugar levels. What you eat and how much energy you expend both play a significant role in determining blood sugar levels. This is due to the fact that magnesium assists your body in the metabolism of glucose and insulin. A large study that was conducted over the course of 6 years found that low serum magnesium levels were linked to insulin resistance as well as an increased risk of prediabetes. Additionally, it was discovered that common variations in magnesium regulating genes, such as those that result in low serum magnesium levels, were associated with an increased risk for diabetes. Unfortunately, the onset of diabetes may make the problem even worse because diabetes causes an increase in the amount of magnesium that is excreted in the urine. 11. Stress. There's no getting around the fact that life can be stressful at times. Additionally, both mental and physical stress can result in a magnesium deficiency. Even things like surgical procedures, long-term illnesses, medications, or traumatic experiences in one's life can play a role. Your body will have an increased requirement for magnesium during times of increased stress. Stress can make an already difficult situation even more difficult if you are already struggling. When magnesium levels are low, there is also a possibility of an increase in the levels of the stress hormones, adrenaline and cortisol. 12. Vertigo. Magnesium plays an important role in the regulation of the levels of other minerals found in the body, including calcium, copper, potassium, and zinc. Your risk of developing an electrolyte imbalance, which can lead to symptoms such as dehydration, dizziness, and cognitive decline, can therefore increase if you do not get enough magnesium in your diet. If you find that you are easily fatigued, lightheaded, or dizzy on a regular basis, then you should make sure that you stay hydrated by drinking a lot of water. It may be helpful to take a magnesium supplement in order to alleviate some of these symptoms. Recommended daily intake of magnesium. The recommended amount of magnesium intake for adult males ranges from 400 to 420 milligrams per day. Daily dosages of between 310 and 320 milligrams are suggested for women. The first thing that should be done in order to alleviate the symptoms of magnesium deficiency is to increase the amount of magnesium that is consumed in one's diet. This is the first step that should be taken. Magnesium is an essential mineral that can be found in a wide variety of delectable foods. Some examples of foods that are rich in magnesium include pumpkin seeds, almonds, spinach, black beans, avocados, and dark chocolate. The consumption of magnesium in its natural form through the consumption of foods is always recommended as the primary method. However, you can increase your magnesium intake by taking magnesium supplements if you feel that this is necessary. Magnesium risks. Anyone who has kidney disease or any other condition that affects kidney function should not take magnesium without first discussing the possibility of doing so with a medical professional. In addition, there are people who are unable to tolerate magnesium because of the negative effects that it has on the digestive system. An overdose of magnesium can cause a variety of symptoms, including nausea, diarrhea, fatigue, low blood pressure, and weakness in the muscles. It is strongly recommended that a consultation with a qualified medical professional take place prior to making any changes to your diet, supplement routine, or seeking medical attention for any of the symptoms that are described in this video. Even though magnesium deficiency is relatively common, the condition can have serious repercussions if it is not treated. It is essential to avoid dismissing feelings of exhaustion or weakness as unimportant. Your doctor may be able to determine the underlying cause of your symptoms with the assistance of a blood test or a check of your calcium and potassium levels. Now that we have learned about the signs of magnesium deficiency, let's discuss another topic that may be of interest. Did you know certain drinks can greatly benefit your health? Wondering what they are? Watch. Drink clove tea every day. See what happens to your body. Or watch. The longest living people drink this every day. Go ahead. Watch one, or even better, watch both. Will you be more cautious of your magnesium intake? Let us know in the comments below.